February 24th, 2021. I'm Tulio Sirgusa, broadcasting from Southern California, and I'm joined today by Kim Lantis, who is joining us from Wyoming.
That's
Hi,
okay.
Kim.
Hi.
And Carlos Ponce from Cuernavaca, Mexico.
Hey, guys. Thank you for having me here again.
And of course, the reason we do this is for our guests. We have Dr. Vik Bakhru, who is the Chief Operating Officer at ConsejoSano, joining us today. Welcome to the show, Vik. Great to have you.
Likewise, great to be here. Thanks so much for the opportunity.
So we're going to be having an interesting conversation today about equitability when it comes to digital health. But before we go into that, let's get to know you a little bit. If you could please kindly introduce yourself, tell us something about you that we'd like that the audience can get to know you, and then we'll talk about ConsejoSano. We'll see how that. Let's start with you.
ConsejoSano. ConsejoSano. You need a Spanish speaker here, Tulio,
exactly.
Please.
He's just showing off because he's
Well, that's great.
All right.
Yeah. So, physician by training, ended up getting training in general surgery, and then did an MBA. And that was out in Philadelphia at the Wharton School. And after that, I moved into hospital administration at New York Presbyterian Hospital in New York City. Had a phenomenal experience there, worked with some really, really great physicians and nurses and providers, as well as a great administrative team. After that is really when I started working in earlier stage companies. And so I first worked at A&K Global Health, which was a medical travel provider. I spent about 95% of my time on the road, traveling internationally, meeting with hospitals and finding ways to deliver care to people who didn't have access to it locally. So think of civil servants in Kenya who may have needs for advanced kidney care that wasn't available where they lived. And so we would find a way to help transport them to areas where they could get advanced care, sometimes India or Eastern Europe, for example. After that, worked in San Francisco and built a telemedicine startup called First Opinion. And we were really one of the first app-based telemedicine options where you could chat, message back and forth with a clinician. And so a little bit different than like the Doctors Without Borders model, more, sort of akin to download the app, get connected to a clinician, ask some quick questions. Hey, my kid's fever is 102. Should I be going to the ER or, something else? And then, after that, moved to Los Angeles, which is where I speak to you from now, and work with ConsejoSano, which means healthy advice in Spanish. And we basically engage patients that are culturally diverse and typically underserved. About 90% of the patients we serve are on Medicaid. And our clients are typically health plans and providers, organizations for whom we're trying to build a better relationship between them and their members or patients. Happy to get into more detail.
Yeah, please tell us a little bit more. Thanks for the introduction. It sounds like you did a little bit of similar to Doctors Without Borders. That's amazing work. Very noble work doing that international work. Tell us about the company itself. What gave birth to the idea? What is it? What's the mission? We'd love to get to know the company a little bit.
Yeah, absolutely. So our founder and CEO, Abner Mason, recognized that there was a gap in the healthcare system between patients and between the healthcare system. So, many times when we think about access to care, we think about it in terms of calling your doctor's office, trying to make an appointment, getting in for a visit, and these days maybe a telemedicine appointment. But pre-COVID, and certainly around the 2014-15 timeframe, there just weren't a lot of options for people to access care if they didn't know how to access the healthcare system, if they didn't know where to go. And so Abner really wanted to focus on how do you bridge that gap between patients who are culturally diverse and a healthcare system that really wasn't built for them 30, 40, 50 years ago. And many of the legacy components of our healthcare system that are still here with us today, fax machines included, when much of the care that's delivered today isn't meeting the needs of an increasingly diverse population, how do you build a platform that really understands who they are and how they live their lives? We think about it in terms of culture, and we think about it in terms of cultural determinants of health. So what are the attitudes, beliefs, traditions, values in the household, and how do we understand it before we talk to the patient so that we can really engage them and build trust. At the end of the day, we function as a company to build trust between the patients and their health plan or provider.
We have so many questions, especially with the impact of COVID in this past year. But before we go into those questions, let's introduce the topic and kick it off. Who's doing that today? Kim, Carlos? Who wants
Kim's doing the honors.
All right,
please.
Kim, go for it.
Thank you, Tulio, and welcome, Dr. Vik. So today's chosen topic, as chosen by you, is scaling an equitable digital health business. Essentially, how to turn a service-focused dream into real-world business success. So I think you've already given us a really good introduction as to your heart and how you've pretty much been service-driven your entire life. And so I'm really interested. I think right now, all of us, it's very common to try to find this balance between meaningfulness and having to make a living, essentially. So what was that process for you? What was that aha moment, or what was it that made starting ConsejoSano possible?
Sure. And, you know, for clarity, Abner Mason was really our founder, and I joined the company about 3 years into its development. But I would say from a mission-driven standpoint, certainly I identify as a mission-driven individual. And a lot of that experience actually predates ConsejoSano. It goes back to a nonprofit that I started called Foundation for International Medical Relief of Children, or FIMRC. And our work there was to set up primary care clinics, and we ultimately scaled to about 3,000 staff and volunteers worldwide in about 10 different countries. And our goal was to bring access to primary care to communities that may not otherwise have had access to it. So sometimes it meant building a clinic, other times it meant building a community center, still other times it meant doing a lot of public health work to understand the needs of the community. But a lot of my interest in mission-driven organizations, and specifically in the realm of public health, stems from that experience. At ConsejoSano, we think about a lot of our opportunity to have impact in the lives of people who have needs, who are, perhaps, on Medicaid and live very complicated lives. We want to make it easier for them, right? We want to deliver a patient experience and a concierge, service, to help them, get access to the care that they need.
So I think you already mentioned a few of these things, cultural specific, value specific, but when it comes to making equitable digital healthcare, equitable healthcare in general, but specifically digital, what are the factors or the complications? What is it that needs to be addressed to make things golly, say that word 10 times fast. Equitable.
Absolutely. No, I'm glad you asked, because, when it really comes down to it, it's about understanding the individual patient and their needs. And that's what I think our healthcare system sometimes, misses the mark on. How are we really understanding where each patient is at, and how do we meet them where they are? And before they're a patient, they're just a person. And so how do we understand where each person is in their journey, and how do we help educate them? Sometimes there's an education gap. Other times it's not an education gap, it's an accessibility gap. And so understanding that a Vietnamese speaking individual who has been auto-matched perhaps by their health plan to an office that doesn't offer culturally relevant care, or care that matches the preferences of that person, going through that process and being there as a resource for them. So when I think about equitable healthcare, and I of course believe that healthcare is a human right, we should not reserve resources that improve our health for those who can afford it. We should be able to offer it as a society, as a global society. We should be able to offer it to those in need, right? That's why we develop these technologies and offerings and these capabilities as a healthcare system. So, a lot of the equitable healthcare, sort of conversation for me begins by aligning around the fact that we exist to serve. We exist to serve all equally. And we really want to be able to make sure that we're making the right resource allocation decisions. And that starts with surveying and understanding what people need, right? And those barriers, to your question earlier, those barriers are social determinants. If they have a transportation barrier, if you have people who live in a community where there's a low percentage of motor vehicle ownership, telling them to go to a clinic that may be an hour away from their house just gets complicated, right? And so you got to start the conversation by offering. Yeah, go ahead.
It's interesting. I think it's safe to say that this past year, what COVID has certainly highlighted is the incredible gaps in terms of equitable health care
Yeah.
and the dramatic and epic impact that has had on especially in Black and Latino communities,
Yeah.
which is where you've had the majority of hospitalization and deaths. And then you compare it to those who have access to health care, who have kind of ahead of it sometimes, who
Yep.
have not even ended up in the hospital. And you wonder how many people could have avoided ending up in the hospital or even dying if they had access to proper care in advance of it getting worse. How has this changed the trajectory of your business in terms of raising awareness and making it a mainstream conversation that needs to be had and needs to be something that becomes a forefront toward making healthcare equitable? How has it changed or enhanced what you guys are doing?
Yeah, thanks for bringing this topic up, because it's so crucially important for us to understand and then to be able to move forward together, so that we can address those gaps and we can avoid what has happened through the pandemic in the communities that you've highlighted, which I strongly agree with your points there. It boils down to advocacy at the end of the day, and making sure that we are fairly representing the needs of all members of our society. And in the case of ConsejoSano, our story, started with 30,000 patients in 2017. And when you talk about scaling in digital health and scaling, in a digital health company focused on equitable access to care, we, ended up with, a tremendous growth trajectory. We went from 30,000 patients on contract to over 120 million on contract today. And we actively serve between 1 and 2 million in any given month in terms of, the patients for whom we are contracted to either conduct outreach or a variety of activities. To give you a sense of that growth, it was concentrated in 2020. Much of that growth happened through the pandemic because the needs were being highlighted and because the health plans and providers were trying to find ways to meet that need and trying to find ways to, to support. And because there wasn't necessarily a known pathway of how to do it, they reached out to companies like ConsejoSano. And so, to give you a sense, in 2020, we did 4 times the amount of work in all of 2019. We did it in Q2, April, May, and June last year. 4 times the entire year's worth of work in terms of message. We send a lot of text messages, have conversations with people, that kind of work. And so I hope that gives you some context, but it all boils down, just to tie it back to advocacy. How are you acting in the best interest of those who sometimes aren't in a position to know that they can ask for things or to know that resources are available? We should not have someone covered by a government health plan that doesn't understand the full extent of benefits that are available to them. Someone's got to do the heavy lifting of bringing people up to speed on, hey, these are your benefits. You get 12 rides to the pharmacy. Let me help you pick up your medications. Or here, this is another benefit covered by your health plan. Or here, this FQHC that you already go to has a food pantry. I'm not sure if you knew that, and you may not need it, but I wanted to make sure I did my job to,
So I'm curious about how technology is helping to drive some of these initiatives, which is also a challenge in terms of equitability as well, because some of those underserved markets also don't have equal access to technology. So how is that helping to drive this forward, and what else can be done and needs to be done?
Yeah, I spent a lot of time in the early stage digital health environment. And what I notice all too often is that we let perfect be the enemy of good. And we've got to get away from this notion that you have to build a perfect platform and in order to, actually deliver the care that you need. And so what you start with, what the right starting point, I would say, is, trying to find native capabilities, existing pathways for the exchange of information. And in our case, that was text messaging. And so, in our world, we don't try to get too fancy. You can do a lot through text messaging. It's flexible. It allows, exchange of information and people to do interesting things. And so, in any case, we really spend a lot of time trying to figure out, how to take what we've built and make it available to the maximum number of people. And sometimes it's as simple as a text message. Other times it makes sense to actually do a phone call and reach out and really get to know someone.
I think that's really beautiful, the simple usability, because I may be mistaken, but I'm guessing that the majority of your users are elderly or English as a second language. And therefore, the simplest way that you can make things, the better. And I really love what you said about not letting perfect be the enemy of good, because in some cases, that's absolutely all that is needed.
Yeah, yeah. Or progress. I mean, pick your phrase or analogy here, but how do we just make progress, and how do we do right by the people who deserve the care that many of us receive. I can pick up an app and schedule an appointment with my doctor today. It shouldn't be that way. It shouldn't be that everyone doesn't have that that same access. Yeah.
Carlos.
I'm curious about asking you something in particular.
Sure.
We've had conversations on DojoLIVE with other medical doctors and physicians that have gotten into technology. Just to say something about the expression that I'm trying to come up with.
Sure.
So, and I'm looking at your background. I mean, it's impressive. You got.
Oh, you're too kind.
Economics, biology. So what I'm curious about is, with all this scientific background and all this diverse background, how was when you decided to step into the tech world, into health tech specifically? How was your experience? And I'm just asking this from the layman's point of view, the user point of view. How did you get into that? I mean, how was was it easy for you to adapt to the tech world? What can you tell us about that? I'd be interested.
Yeah, sure. A couple of quick points come to mind. First, I think about healthcare as much broader than just physicians. I think about the amazing nurses, the wonderful physical therapists, the incredibly talented other stakeholders. So I really think about clinicians in the space. And to your question about when clinicians decide to cross over into technology and adopt, there's so many ways that happens, right? Every clinician is already a technology user in this country. That's an overstatement. Many clinicians are, using technology in that document in an electronic medical record. Many there. I still know a few offices that run on paper charting, and so it is what it is. We'll get there eventually. But the point I'm trying to make is that the crossover for me. You mentioned economics and biology, and that's all true, but what it represents is confusion. It represents a lack of decisiveness. It represents that, what I believe is true about most people who go through careers and make decisions along the way. It's an iterative process. You've got to start somewhere. You've got to see what you like, what you're good at. And that process, it happens over decades, in truth, right? And so when I think about the last 20 years of my career, so much of it has been a process of learning, and I expect that to continue. But what I typically tell people is, this was not a master plan. This didn't, involve me sitting down in front of a whiteboard and saying, what are my values and where can I make the most money, or where can I, support my family, or where can I have the most impact? Or it was not strategic. It was absolutely a 2, 3, 4 year, type cadence of, okay, I'm in practice. I really enjoy the patient environment. I am the geek that loves to figure out how to create the templates in the electronic medical record. And I love having conversations with our IT folks. In fact, they run when they see me coming because they know I'm going to have
his work.
Right.
So it's different. I fell into it in some ways.
So it was rather organic. That's what I'm hearing, right?
Very much so. And I think for most people, the truth is it is. I just don't think many clinicians wake up and say, I want to go build software. Because if you said
that's what I was going to ask you about.
If you really said that, if you woke up and said, I want to build software, it means you don't know what it takes to build software, because no one really chooses once you've gone through clinical training. It's tough. It's hard. Building software is not a straightforward task. And major credit to the engineers out there who make the world work. Right at the end of the day, in terms of a lot of the technology we use.
Talking about going back to culture and values, in which ways is ConsejoSano serving people who, backing up, the user base is mostly US based, or is it?
We primarily serve a patient base, a group of people, that are in the U.S. and 90% are on Medicaid.
Okay.
And so, we also serve Medicare Advantage and commercial in terms of, how the type of insurance that people have. It's one way that we segment. The other way to think about it is we serve, very culturally diverse individuals, which is different than ethnicity. So this means we serve 100% of Americans, or have the capability of serving 100% of Americans.
That's really beautiful. So what are some of the examples of cultural differences that you do address? Like, one of the things that comes to my mind is that I think in some cultures, women may not feel as free to talk about their bodies or expose their bodies, or perhaps need to have another person with them when getting medical attention. So am I off? Am I on? What other examples are there that you're able to work around?
Literally, we sit around a table. Well, we used to sit around a table. Now we sit around computers, and we used to, we basically get together and we try to assess and understand what are those frameworks, right, around different cultures, and we map out a culture, and then we go get some, feedback from the field, if you will. We talk to people who, who identify with that culture, right? So when we think about, to use, an example of culture. In an LGBTQ-focused initiative, we might think about the trans male population and the need for cervical cancer screening, and how you handle that topic, given how someone identifies, is very culturally specific, right? You don't want to offend. You want to enter the conversation with the, with the right level of sensitivity, so that you ultimately achieve the objective, which is screening for cancer, so that, we don't have poor outcomes for individuals who, who have a certain anatomy, for example, in this particular, case. So culture is not just ethnicity. To your point, I love the example.
It didn't even cross my mind. Thank you.
Yeah. Absolutely.
So, Vik, what's next? What's on the horizon now for ConsejoSano?
We're in this exciting position where we work with some of the largest, insurance companies and doctors' offices and clinics in the country. So we work with Anthem and Molina and United Healthcare and Humana, and some of these names, that represent a lot of access to people in need. And so we really see it as our responsibility to try to find ways to connect with their members, to build trust. We are a white label company, so we operate under the banner of our clients. And we, again, really come to work every day to form relationships. And our platform, you should know, is a combination of people and technology. So you have to have the human touch to make the technology drive forward. And we really believe that, our team of care coordinators, a group of, passionate, highly committed, some of the most amazing individuals I've had the chance of interacting with, they're the ones doing a lot of the outreach and a lot of the back and forth and actually building that trust. And they're supported by technology. So, whereas inside of a health insurance company, you might have a case manager that has 400, 500, 600 members or patients that they work with, and then that's on their panel, if you will. We think about it in terms of how do we get panel size to be 10 to 20,000. So how do we use technology to amplify the kindness of the people on our team, and the capabilities, of impacting folks around. So when we look ahead, we think about how do we continue to scale our technology? How do we continue to, have the opportunity to impact more people? And again, we're so excited that we're in a moment in history where we have the opportunity to really change how healthcare is delivered and make sure that we're not leaving people behind, because that is what has happened, and it absolutely can't be the path forward if we are going to all get through the pandemic, if we're going to make progress on things that just shouldn't exist. We should not be detecting cancer in stage 4. Breast cancer in particular, right? Which is, as if you've seen the news lately, overtook lung cancer. There's so much that we can do as a society to prevent the known and to manage chronic diseases, right? Why, it's a gap in trust that ends up being the issue as to why someone may not get a blood test that they need to measure the progress of their diabetes, or, to get their medications refilled, or, there might be financial barriers. There might be, like I said earlier, transportation barriers. So we really think very holistically about how do we solve for getting people access to the care? And in particular, again, we focus on an underserved demographic, on an underserved group of individuals.
So you guys are a private company, right? So but you mentioned advocacy is a big way to reach out to these underserved communities. Are you looking into partnership with local state government to enhance those outreach? Are you working with the census to figure out where to make these outreach? How are you actually figuring out where to go bring these kinds of services so that you can increase equitability? How are you guys doing that?
Yeah, it's a great question. And so, we spend a lot of time thinking about how do we make the right choices as a company to maintain that equitable approach. Private companies in particular have a responsibility to take the company in a direction that maintains your core values as a team, as a company. And I think we've done just that. And I think it's why we're getting reception from several states right now who, or which are struggling to, make sure that they're equitably distributing vaccines or make sure that they're getting education and awareness out to their communities. And we see ourselves as a partner in that effort. I'm not at liberty to share which states right this moment, but we are, we are currently engaged with several states on that effort. And again, we're a white label platform. So at the end of the day, we want to build trust between public health departments and their communities, between health plans and their members, between doctors and nurses and their patients, right? So we're not obsessed with our name being known. We really want to build trust between the parties that need to come together to improve health outcomes, for those most in need in our country. That's what we care about. That's what we wake up every day to do.
Brilliant. Tim?
Yeah. What's the core of your team? What's the culture of your team at ConsejoSano? What would you say, what does it take to be successful with you? And what is the type of person that you're looking to work with?
Oh, sure. Yeah.
And adding to that, Kim, just one quick thing, if I may. This question might also think of, when you respond to this question, think of the possibility that there's someone out there who might be watching and might want to come work for you, for example, at some point, either now or in the future.
Absolutely.
So what would you say to these people that are interested in working for ConsejoSano at some point?
Yeah, absolutely. I would tell you that like every organization that goes through various growth milestones, when your team goes from 5 or 6 people like it was in 2017 to, hundreds of people as we think ahead to the future, and hopefully thousands of people that are all working toward the common goal of serving the populations that I've noted earlier, your culture ends up shifting, right? And you start, adopting policies and ways of making sure that everyone has the opportunity to be heard in the context of your broader team. And you come up with, intranets. And, this is literally where we are as a company. We think about scaling equitable digital health. It starts with making sure your team is aligned and all working, in the same direction. So we spend a lot of time thinking about that and trying to put it into practice. And it's never perfect. I'll tell you, as an individual who's had the benefit of working with so many gifted and talented people, you end up wanting to make sure there's enough opportunity for voices to be heard. And that's where we are right now, is making sure that, especially some of the new folks coming in who bring incredible experience, that's literally where we are. It's survey, it's assess, it's, hear, learn, listen, and then obviously act upon and deliver for your team so that you can have that alignment, because it all gets felt by the patient at the end of the day, right? All of our outreach, the psychological safety of my team is one of my top priorities, so that they can be effective for the patients that they serve. In terms of folks who want to come and join us, go to our website, click on careers, look at open positions, reach out to me on LinkedIn or Twitter. I'm, very accessible. I respond to my messages myself. And so, feel free to get in touch. I would love to hear from you, right?
Excellent.
Perfect.
Excellent.
Excellent. Thank you. Thank you
Vik,
so much.
It's been wonderful to have you. Look, a lot of companies say that they're here to change the world, to make the world a better place. Very few actually do it. You guys are committed to something that's very worthy. Thanks for being on the show. Just stay with us as we go off the air in a minute. Carlos, what do we got coming up? Anything else this week or next week? What do we got coming up?
No, well, not this week, unfortunately, but next week we have a full house. We have a full house of very, very interesting conversations with experts. And also the mix is very interesting because, for example, on Tuesday, on Monday, you know that we have the recap show in which we recap in 10 minutes this week's interviews and conversations. So on Tuesday, we're going to be speaking with Ty Caldwell, the principal of a company called ShareShare. That's a very interesting company. They're a platform and an app that connects the public with barbershops.
That's going to be great. I can't say Equitable, and now I have to say Share.
Yeah, Share. Yeah, exactly. So with barbershops and salons. So that should be interesting. And then the next one is the one on Wednesday, where we're going to be speaking with Suba Sethi from Synchrony Financial. That's a fintech company. And then on Thursday, we're going to be speaking with Darius Santos, the CEO of Dub, which is a digital video tool production company and platform. So we have a full week, and I don't know if Tulio, if you have something Wednesday morning.
Let me check. We might have a Wednesday morning show next week.
Yeah,
not next week, but it could happen. But anyway, we have 3, so we have 3. We're on every day at 12 noon except Fridays.
Except Fridays,
because we have to have lunch once in a while.
Absolutely.
Thanks for joining us, everyone. Until next Monday, stay safe.
Thank you.